This morning, at least one public health official is questioning whether long COVID is a severe threat to Americans. In a new Wall Street Journal op-ed, Johns Hopkins University professor Dr. Marty Makary says that while long COVID is real, he believes public health officials exaggerated the condition, writing, quote, "The CDC claims that 20% of COVID infections can result in long COVID. But a UK study found that only 3% of COVID patients had residual symptoms lasting 12 weeks. What explains that disparity? It's often normal to experience mild fatigue or weakness for weeks after being sick and inactive and not eating well. Calling these cases long COVID is the medicalization of ordinary life." Well, does anyone share that opinion? We're going to ask Dr. Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security. So this doctor is a colleague of yours. Is that fair to say?
Yes, yeah, he's a colleague of mine.
So what do you think of what he wrote in the Wall Street Journal? Exaggerating to scare Americans into thinking, hey, you don't want to get this, you better avoid it, get your vaccines, etc. But actually, it's not that big of a problem. What are your thoughts?
He makes some valid points, and I think what you had up on your screen a minute ago is one of them, that when you look at studies, you see these varied prevalences, and that has to do with how rigorous the studies are conducted. And when you do studies that use control groups, meaning that you have people who didn't get infected with COVID, and you ask them what symptoms they may have and compare them to those who had COVID, you see that 20% number come down. So I do think that long COVID is a real phenomenon that we need to understand, but it shouldn't be thought of as the norm, that that's what's going to happen if you get COVID. It happens in a minority of people, and people do get better over time. And it's likely something that happens with many other infections that just have not been studied the way that long COVID has been studied or recognized the way long COVID has been. And it may be that the other phenomenon is that so many people got infected, and a small percentage of a big number is still a big number. But it's not the same as thinking that this is something that erases all the progress we've had with vaccines and antivirals. And there is that sentiment out there where people think we're still at square one because of long COVID and not recognizing how valuable the vaccines have been at preventing deaths and hospitalizations and even long COVID.
Well, I wonder, though, is there sufficient evidence? Because it seems like we've just been playing catch up on COVID. It was a novel coronavirus. We learn more and more about it. And what we're learning is still changing every day. So do we even know enough at this point to say what your colleague has said, which is that we might have exaggerated it? Are we going to find out 3 months from now that we haven't exaggerated it? You know what I mean?
Well, I do think that what you have to look at when you look at the percentage of people who develop long COVID are rigorous studies with control groups. And that's what he's citing. He's citing studies in where they use control groups. When you have many studies just ask people after they've recovered from COVID-19, do you have these symptoms? And you can't really make heads or tails of that because you need to compare it. It needs to be done rigorously. So what I think his op-ed should be a call for is much more rigorous studies to define long COVID, to actually separate it from other illnesses that may have been present before. There's one study that shows I think up to 50% of people meet long COVID definitions before they even get COVID. So there clearly is a problem with our definition, and we clearly have to get much better at using science to unravel this phenomenon. But I don't think what we should do is think of this as something that kind of countenances all the progress we've had at dealing with COVID.
And that is Dr.
It should be something.
Excuse me, I'm sorry. That's Dr. Adalja. I apologize for screwing up your name at first, but I wanted to correct that. Thank you for joining us.
Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.